So this is another important area which is asked frequently, the immunofluorescence pattern. Let us quickly review that. So homogeneous or diffuse pattern, homogeneous or diffuse ANA pattern. Remember, this is common with dsDNA. Okay, remember diffuse, D for DS, anti-dsDNA antibodies, they will show diffuse pattern of immunofluorescence like in SLE. Okay, and then you have speckled ANA, nucleolar centromere pattern, that is important here. Remember speckled, there are multiple things that are associated with speckled. Okay, nucleolar के लिए very important to remember is systemic sclerosis, the scleroderma and even polymyositis. So SCL70, right? Remember scleroderma SCL70 and polymyositis SCL together, right? This stains the nucleoli. Centromere, C for C, important. It is seen in CREST syndrome, which is limited systemic sclerosis, not causing the interstitial lung disease vagera. It is CREST, limited one. Okay, so dotted staining of the centromeres due to anti-centromere antibodies, and then you have, these are all in the nucleus that we are talking about, right? Diffuse, or it is speckled, or nucleolar, or it is centromere, or it can be peripheral also. In cytoplasm, you have the mitochondria, right? So anti-mitochondrial antibody, which is going to be there in primary biliary cirrhosis, or the microsomal, anti-LKM, microsomal also in the cytoplasm, which is present in autoimmune hepatitis. So that is going to be cytoplasmic. Okay, let's have a look at the image. Peripheral type, homogeneous diffuse type, at least remember anti-dsDNA and antihistone here. Then you have centromere is going to be CREST, right? And nucleolar is going to be systemic sclerosis. Okay, systemic sclerosis. Nucleolar में कैसे होता है? ऐसे बड़े-बड़े circle दिखेंगे, 2-3 ऐसे दिखेंगे, right? The nuclear one are going to be more bigger circles there, nucleolus जैसे होता है, right? And this is the peripheral pattern, this is homogeneous pattern, and speckled is small dots. Okay, so this is what you need to remember here. Now in this image, the pattern that you are seeing here, this is nucleolar pattern, plus they have asked interstitial lung disease ka risk. That means we are talking about systemic sclerosis here rather than the CREST wala here. This is the classical fish mouth appearance that you see in scleroderma, right? So all of this put together will give you the answer as it is anti-SCL70, systemic sclerosis wala. This is going to be anti-SCL70. Is this clear with everyone? Okay. So yes, definitely. dsDNA is both diffuse and peripheral as well. Annotated PDF, of course, for every class and every video attached to it, you see a blank PDF and annotated PDF post class, which is attached, right? So after the class, you will see this video, the KBMDs, these are being uploaded in the test or MCQ discussion folder. KBMD NEET PG 25 वाला सब folder है उसमें आपको ये सब videos with the way मिल जाएगा. ठीक है, clear with everyone? The anti-U1 RNP, this is going to be in your MCTD, mixed connective tissue disorder. Okay, SCL70 is also anti-topoisomerase, right? So important to remember, systemic scleroderma is anti-nucleolar and CREST is C for C, centromere. Okay, and when they talk about interstitial lung disease, it's systemic, which is more common, so the answer is going to be that.